sometimes we can appreciate a person's utilization of a method or a principle or a technique through a patient example. And I didn't prep you for this, Tim, but I'm just thinking as we're chatting, is there a patient that you can think recently that you effectively utilized? You came to a place where you thought this is an appropriate place where dry needling is not only going to be something that I can do, but should be, or I can predict, kind of like Dr. Donnelly mentioned, that it should be helpful with this patient. Anyone come to mind?
Sure. I had recently had a patient who had, he did have cervical pain, but he also had headaches and at the top of his head. And I do recall that the referral pattern for that type of headache could be coming from sternocleidomastoid. So with every patient that comes through the door, this is a certified McKenzie clinic, so everyone gets a McKenzie exam.
Sure.
But I don't let my assessment stop with that in some cases. And I do utilize, particularly for cervicogenic headaches, some Maitland-like assessment process. So I can find their concordant pain or their most comparable sign. And it was pretty clear that there was a component of this that was coming from his upper cervical spine. And he did respond to, some repeated movements and some sustained postures within the McKenzie system. But it wasn't zipping up the whole job. So, he was open-minded, and we talked a little bit about dry needling in this region. Because Jan Dahmerholt is within probably 30 miles of here, there are a plethora of people using dry needling. So it comes up routinely, people ask, what is dry needling? So it came up, and because we really weren't sealing the deal with the headaches, his neck pain was doing quite well. In fact, his baselines, in terms of rotation and such, really normalized and seemed less a component of his headache. So we did dry needle his sternocleidomastoid, and upon palpation, of a top band in his SCM, it did influence or reproduce his concordant headache. And it's not and I try and tell patients, I don't really love sticking needles into people. It's really nothing I thought that I would get into, but I have had the training, and that, the assessment process led me there. We did it, and his headaches were resoundingly better afterwards.
Mm-hmm.
We did it several times, and then he moved to Japan. So but before he did, it seemed like we were going down the right road, with, a little bit of a McKenzie approach and some dry needling. And that's one case where I can explain.
Mm-hmm. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.